Meet Sandy, a respiratory therapist with the University Pulmonary Rehabilitation Program. Sandy uses many techniques to help people exercise their lungs, including respiratory therapy devices that provide breathing treatments. One of her favorite devices is the BiWaze Clear System. Sandy likes BiWaze Clear because it replaces respiratory therapies from 3 different pieces of equipment with a single device, reducing therapy time and saving money. The 3 therapies include PEP therapy to expand the airways, oscillation therapy to break up and mobilize mucus, and nebulization to calm the airways and thin mucus that has become stuck. Let's look at how BiWaze Clear provides these therapies. The PEP, or positive expiratory pressure therapy, expands airways and holds them open. The air also gets behind mucus blockages and moves it up to the upper airways. Alternating with PEP is OS, or oscillation therapy, that helps loosen and thin mucus during both inhalation and exhalation. This reduces blockage size and assists cilia to move mucus to the upper airways. Lastly, the nebulizer delivers medication during both the PEP and OS therapies. Beyond medication delivery, it also helps thin blockages and reduces airway inflammation. BiWaze Clear reduces therapy time from 3 devices and 30 minutes to 10 minutes with a single device. Today, Sandy will be working with 2 patients, Maya and Helen, who have different diseases and can both benefit from BiWaze Clear's therapy. Maya is a college freshman with cystic fibrosis. Living in a dorm with roommates, personal space is limited. Sandy wants Maya to try BiWaze Clear for a few reasons. First, because it has a closed circuit, so Maya won't have to worry about spreading airborne particles in the dorm. Secondly, to help with Maya's compliance to therapy. Maya has not been consistent in completing her prescribed therapy due to her busy college schedule. Sandy hopes BiWaze Clear's therapy will improve Maya's compliance. Lastly, the small, lightweight device is battery-powered, giving Maya flexibility in where she conducts her therapy. After Maya, Sandy sees her next patient, Helen. Helen is a grandmother with bronchiectasis who has recently joined the pulmonary rehab program. She used BiWaze Clear in the hospital, and it helped open her airways and cleared the mucus stuck in her lungs. She is glad she can continue to use BiWaze Clear while in rehab and at her home because the therapy helps her breathe easier. Sandy thinks BiWaze Clear is a good respiratory therapy device for Helen for several reasons. First, because it has a closed breathing circuit, so Helen won't have to worry about spreading airborne particles in her home or when traveling to see her family. Secondly, it is lightweight and battery-powered, so Helen can bring it with her when traveling. Lastly, it has a simple touchscreen interface, so Helen can easily select one of her 3 therapy protocols from a drop-down list, and it is a single button press to start therapy. Sandy loves how BiWaze Clear helps her patients breathe easier and the flexibility it offers them by combining multiple respiratory therapies in a small, lightweight device. BiWaze Clear gives all of Sandy's patients, both children and adults, access to the therapies they need, whether it is in the hospital, long-term care, rehab, or at home. To learn more about how BiWaze Clear makes breathing easier and how its closed breathing circuit is designed for safety of patients and caregivers, visit abmrc.com.